For many, a diabetes diagnosis is a wake-up call. You can get a diagnosis at any age, and it's important to know what you can do to help yourself live a normal life with diabetes. Controlling a case of diabetes is usually a question of managing your blood sugar levels and living an active, health-conscious life. Medications, insulin for type 1 when the body cannot make enough insulin, but often other medications for type 2, for when the body does not use its available insulin correctly, are also used to keep your blood sugar under control and to manage your symptoms. Getting your diabetes under control so you can live a happy and healthy life is the goal. The content in this article refers only to general cases and is not intended to replace the opinion of a doctor or following your medical team's advice. Part 1, Making a Diabetes Treatment Plan. Type 1 Diabetes. 1. Consult with a doctor to start or adjust your treatment plan. Type 1 diabetes, also called juvenile diabetes, is a chronic disease, which, despite its name, can begin and affect people at any age. This type of diabetes is an autoimmune disease. While it can occur suddenly due to infection, symptoms will usually appear after an illness. Symptoms in type 1 are usually quite noticeable, more severe and quicker to cause illness. Symptoms for type 1 or advanced type 2 often include increased thirst and frequent urination, dehydration, possibly extreme hunger with confused appetite, nothing satisfies you, unexplained blurred vision, unexplained weight loss, unusual weakness, fatigue, irritability, slow healing sores, frequent infections such as gums or skin infections and vaginal infections, nausea and/or vomiting, ketones in the urine. In medical tests, ketones are a byproduct of the unhealthy breakdown, loss of muscle and fat, wasting away, that happens when there's not enough available insulin to support life. 2. Seek medical attention immediately if faced with any of the following severe problems in untreated type 1 or 2 diabetes. These can be life-threatening. They may include weakened immunity to infectious diseases, poor circulation, including in the eyes and kidneys, illnesses, infectious diseases, numbness, tingling in toes and feet, infections slow to heal, if at all, especially in toes and feet, gangrene, dead flesh in toes, feet, and legs, usually without pain. 3. Watch for initial symptoms of type 1 diabetes being severe. It is not uncommon for you to have to stay in the hospital for a short time after your diagnosis. If you suspect that you have diabetes and delay seeing a doctor, you can end up in a coma. Always rely on the advice of a qualified doctor or specialist when deciding on any plans to fight your diabetes. Neither type 1 nor type 2 diabetes can be completely cured, but with a lifelong commitment to your treatment plan, these diseases can be managed to the point that you will be able to live a normal life. Begin your treatment plan immediately after you develop diabetes, for better health. If you think you may have diabetes, do not wait on seeing a doctor. It is highly recommended that you see a doctor. 4. Take steps to understand diabetes. You're here, so you are in the right mindset. Diabetes educators are highly recommended. These experts help you understand the different tools available to you, and can help you adjust your meals to better control blood glucose levels. For those who are diagnosed with type 1 diabetes at a young age, an appointment with a diabetes trainer, educator is often mandatory, and they will often meet with you while in the hospital. 5. Take your medications every day. The body of a person with type 1 diabetes needs insulin because their pancreas is damaged in a way that will not produce enough insulin as needed. Insulin is a chemical compound used to break down sugar, glucose, in the bloodstream. Those with type 1 diabetes must work with their doctor to find their correct dosage of insulin, because different individuals have different reactions to various types of insulin, and because some individuals with this type of diabetes may still be producing insulin at mild levels. Without insulin, the symptoms of type 1 diabetes will rapidly worsen and eventually cause death. To be clear, individuals with type 1 diabetes need to take insulin every day or they will die. Your precise daily insulin dosages will vary based on your size, diet, activity level, and genetics, which is why it is so important to see a doctor to get a thorough evaluation before beginning your diabetes treatment plan. Insulin is generally available in several different varieties, each of which is formulated for specific purposes. These are rapid-acting, mealtime, bolus insulin. Usually taken right before a meal to prevent elevated blood glucose levels after eating. Short-acting, basal insulin. Usually taken between meals once or twice a day to control resting blood glucose levels. Long-acting, a combination of bolus and basal insulin, can be taken before breakfast and dinner in order to keep blood glucose levels low after meals as well as throughout the day. Intermediate-acting, combined with rapid-acting insulin. It covers the blood glucose elevations when rapid-acting insulins stop working. This type is typically taken twice a day. 6. Consider an insulin pump. An insulin pump is a device that continually injects a bolus rate insulin to mimic the effects of the basal rate insulin. Your blood glucose level is entered into the device at meal times and in accordance with your normal testing schedule, and your bolus is calculated for you. In addition, a carbohydrate ratio can be set and be added to the bolus calculation as well. There is the new tubeless, no tubing, insulin pump that is an all-in-one unit that typically come loaded with a 3-day supply of insulin with the battery and pump built in. It is the Omnipod, that is wirelessly controlled by a personal diabetes manager, PDM. It takes ideally about 10 pumps per month that come in a box holding a 30-day supply. The old, standard injection set consisted of a plastic cap attached to a catheter that injects the insulin, subcutaneous delivery of insulin. It was inserted into your chosen injection site brought from the pump by tubing called the cannula. The pump set might be attached to a belt or near the delivery site with an adhesive pad. On the other end, the tubing connects to a cartridge that you fill with insulin and insert into the pump unit. Some pumps have a compatible glucose monitor that measures glucose levels just below the dermis. While not as effective as a glucose meter, this device will allow early detection and compensation for sugar spikes and drops. Pump users typically monitor their blood sugars more frequently to evaluate the effectiveness of insulin delivery by the pump to be aware if the pump malfunctions. Some malfunctions of the insulin pump include, pump battery is discharged, insulin is inactivated by heat exposure, insulin reservoir runs empty, tubing loosens and insulin leaks rather than being injected, the cannula becomes bent or kinked, preventing delivery of insulin. 7. Exercise. In general, people with diabetes should strive to be physically fit. Physical exercise has the effect of lowering the body's glucose levels, sometimes for as long as 24 hours. Because the most harmful effects of diabetes are caused by elevated glucose levels, blood sugar spikes, exercise after eating is a valuable tool that uses sugar naturally and allows people with diabetes to keep glucose at manageable levels. In addition, exercise also provides the same benefits to those with diabetes that it does to those without it, namely, greater overall fitness, weight loss, but rapid weight loss is a bad symptom indicating food and sugar is not used properly by your system. You can gain higher strength and endurance, higher energy levels, elevated mood, and more benefits of exercise as well. Diabetes resources generally recommend exercising at least several times per week. Most resources recommend a healthy mix of cardio, strength training, and balance, flexibility exercises. See how to exercise for more information. Though low, manageable glucose levels are generally a good thing for moderate activity for people who have diabetes. Exercising vigorously while you have low blood sugar levels can lead to a condition called hypoglycemia, in which the body doesn't have enough blood sugar to fuel its vital processes and the exercising muscles. Hypoglycemia can lead to dizziness, weakness, and fainting. To counter hypoglycemia, carry a sugary, quick-acting carbohydrate with you while you exercise, such as a sweet ripe orange, or a soda, a sports drink, or such as recommended by your health team. 8. Minimize stress. Whether the cause is physical or mental, stress is known to cause blood sugar levels to fluctuate. Constant or prolonged stress can cause blood sugar levels to rise in the long term, which means you may need to use more medication or exercise more frequently to stay healthy. Generally, the best cure for stress is a preventative one. Avoid stress in the first place by exercising frequently, getting enough sleep, avoiding stressful situations when possible, and talking about your problems before they become serious. Other stress management techniques include seeing a therapist, practicing meditation techniques, eliminating caffeine from your diet, and pursuing healthy hobbies. 9. Avoid getting sick. As both an actual physical ailment and as an indirect source of stress, illness can cause your blood sugars to fluctuate. Prolonged or serious illness can even necessitate changes in the way you take your diabetes medication or the diet and exercise routines you'll need to keep. Though the best policy when it comes to illnesses is to avoid them by living a life that is as healthy, happy, and stress-free as possible. If and when you do come down with an illness, be sure to give yourself the rest and medicine that you need to get better as quickly as possible. If you have the common cold, try drinking plenty of fluids, taking over-the-counter cold medications, but avoid sugary cough syrups, and getting plenty of rest. Since having the cold can ruin your appetite, you'll want to be sure to eat roughly 15 grams of carbohydrates every hour or so. Though having a cold usually elevates your blood sugar levels, refraining from eating as may feel natural can cause your blood sugar to fall dangerously low. Serious illnesses always require the advice of a doctor, but managing serious diseases in patients with diabetes can require special medicines and techniques. If you are a person with diabetes and you think you may have a disease that is more serious than an ordinary cold, see your doctor right away. 10. Modify your diabetes plans to account for menstruation and menopause. Women with diabetes have unique challenges when it comes to managing blood sugar during their periods and menopause. Though diabetes affects every woman differently, many women report having elevated blood sugar levels in the days before their periods, which can require using more insulin or changing your diet and exercise habits to compensate. However, your blood sugar levels during your menstrual cycle may be different, so talk to your doctor or gynecologist for specific guidance. Additionally, menopause can change the way that the body's blood sugar level fluctuates. Many women report that their glucose levels become more unpredictable during menopause. Menopause can also lead to weight gain, sleep loss, and temporary vaginal ailments, which can increase the body's levels of stress hormones and elevate glucose levels. If you have diabetes and are going through menopause, talk to your doctor to find a treatment plan that's right for you. 11. Schedule regular checkups with your doctor. Right after you are diagnosed with type 1 diabetes, it is likely that you will need to meet with your doctor regularly, as much as once a week or more, to get a sense for how to best control your blood glucose levels. It can take a few weeks to develop an insulin therapy regimen that perfectly matches your diet and activity level. Once your diabetes treatment routine is established, you won't need to meet with your doctor quite as often. However, you should plan on maintaining a good relationship with your doctor, which means scheduling semi-regular follow-up appointments. Your doctor is the person who is best suited to detecting anomalies to manage your diabetes during times of stress, sickness, pregnancy, and so on. Those with type 1 diabetes should expect to see their doctor once every 3 to 6 months once a routine is established. Part 2. Making a diabetes treatment plan. Type 2 diabetes. 1. Consult with your doctor before beginning treatment. If you have type 2 diabetes, your body is able to produce some insulin, as opposed to none at all, but has a diminished capacity for producing insulin or is not able to use the chemical correctly. Because of this crucial difference, type 2 diabetes symptoms can be more mild than type 1 symptoms, and have a more gradual onset, and can require less drastic treatments, though exceptions are possible. However, as with type 1 diabetes, seeing your doctor before beginning any treatment plan is still essential. Only a qualified medical professional has the knowledge to definitively diagnose your diabetes and design a treatment plan that's tailored to your personal needs. 2. If you can, manage your diabetes with diet and exercise. As noted above, people with type 2 diabetes have a diminished but not non-existent capacity to make and use insulin naturally. Because their bodies do make some insulin, in some cases, it's possible for people with type 2 diabetes to manage their disease without having to use any artificial insulin. Usually, this is done through careful diet and exercise, which means minimizing the amount of sugary foods consumed, maintaining a healthy weight, and exercising regularly. Some people with mild cases of type 2 diabetes can potentially live basically normal lives if they are very careful about what they eat and how much they exercise. It's important to remember, however, that some cases of type 2 diabetes are more severe than others and can't be managed with diet and exercise alone and can require insulin or other medications. 3. Be prepared to pursue more aggressive treatment options over time. Type 2 diabetes is known to be a progressive disease. This means that it can get worse over time. This is thought to be because the body's cells responsible for producing insulin get worn out from having to work extra hard in people with type 2 diabetes. 16. As a result, cases of type 2 diabetes that once required relatively minor treatment options can eventually require more drastic treatments, including insulin therapy, after several years. This is often not due to any fault on the patient's behalf. As with type 1 diabetes, you should keep in close contact with your physician if you have type 2 diabetes. Regular tests and checkups can help you detect the progression of type 2 diabetes before it becomes serious. 4. Consider bariatric surgery if you are obese. Obesity is one of the leading causes of type 2 diabetes. However, being obese can make any case of diabetes more dangerous and harder to manage. The added stress that obesity puts on the body can make it extremely difficult to keep blood sugar at healthy levels. In type 2 diabetes cases where patients have high body mass indexes, usually greater than 35, doctors will sometimes recommend weight reduction surgeries to bring the patient's weight under control quickly. 2 types of surgery are usually used for this purpose: gastric bypass surgery. The stomach is shrunk to the size of a thumb and the small intestine is shortened so that fewer calories are absorbed from food. This change is permanent. Laparoscopic gastric banding, lap banding. A band is wrapped around the stomach so that it feels fuller with less food. This band can be adjusted or removed if needed. Don't forget to subscribe my channel for more diabetes-related videos.